Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video, I'm going to go over the top 8 ways you can get prepared for nursing school. Now, if you're thinking about going to nursing school or you're actually in the process of going but you haven't started yet, I want to give you 8 top ways you can prepare before you actually start the program. So let's get started. Number 8, get your finances in order. This is so important before you actually go to nursing school. So those months before you're actually thinking about going or preparing to go, you need to be thinking about, okay, what scholarships do I need to apply for? What financial aid do I need to get? You should be doing this at least 6 months or more in advance to make sure you qualify for everything that you can get. My husband, Ben, who's also on this channel, has made a great video on how you can apply for tax deductions, on financial aid options out there to help you save money and get the most out of your money whenever paying for nursing school. So be sure to check out that video. And also, it's really important to get your finances in order because whenever you're in nursing school, you're going to be a little bit limited on how much you can work. So you want to assess where you are financially, how much your monthly bills are, and budget for things that will be coming down in the future. Number 7, start studying for nursing school entrance exams now. Most nursing schools, before you start their program, require you to take some type of entrance exam. And this is similar to an ACT or an SAT. So if you've been out of school for a while, you're probably like me thinking, man, I don't remember what was on an ACT or SAT. So I highly recommend, if you do have to take these entrance exams, that those months before you're actually going to start the program, that you purchase a study guide to help you along. My nursing school required the HESI A2. I know other nursing schools out there require the ATI. Whatever it is, you can always go to the website, your nursing school's website, and see what they require, ask an advisor, and just go to Amazon.com and buy the study guide that the company makes. They have a lot of practice problems in there to help you get ready to pass the exam because you want to do the best you can do. So I really recommend during those months that you start studying for that exam if you have to take it. Number 6, get study guides to start reviewing early. It is a great idea before you start the program that you get some study review guides to help expose you to some material that you're going to be learning in the future, just to be a little ahead of your game. And I recommend 2 different things. First thing I recommend is an NCLEX comprehensive study guide. And I personally use the book by Saunders. You can get whatever you want, but that's what I used. It helped me. I passed the NCLEX first try. But this book is not just for helping you pass the NCLEX, which is the exam that you have to take after you graduate nursing school to become a licensed registered nurse, but it's going to help you at the beginning of nursing school all the way throughout. Literally, I don't think I could have made it through my nursing school exams without this book, and let me tell you why. The book, if you get the Saunders Comprehensive, it's a thick book, and as its name says, it is a comprehensive review. It will cover every single class that you're going to be required to take in nursing school. So let me give you an example. In nursing school, you're going to be required to take maternity nursing, psychiatric nursing, pharmacology, things like that. And in this review book, it breaks down the material, bolds it, picks out the points that you are probably going to see on a lecture exam given by your professor. So it helps you study for those tests. And not only will you be reviewing that material throughout the whole semester, but it's going to help prepare you thinking about NCLEX questions. So I really recommend that you invest in that. And just crack it open, read it, even though right now that material is probably going to be way over your head and you're not going to understand a lot of it, but at least you're going to be exposing yourself to it. And the second thing I recommend is getting a basic drug guide book. You can go to Amazon and just look at drug guide books. I know Mosby, M-O-S-B-Y, makes them. Kaplan, really good books. Just look at the reviews and see what other students are saying, and just get you a basic little pocket guide you can put in your pocket, your lab coat, and that you can just bust out and look and review and pay attention to those common drugs that are ordered. Because in the hospital and clinical setting, you're going to notice that a lot of patients are on the same exact medications, and chances are when you become a nurse, you're going to be giving those same medications, and you need to pay attention to the side effects. So that's going to help you in your pharmacology class, which is another class that a lot of people have difficulty with, and it's just a good idea while you're waiting to go that you just expose yourself and look at those names of those drugs to help you prepare. Number 5, get your family and personal life in order. This is so crucial because while you're going through the program, you need to make sure that your family and other people around you know the expectations of how things are going to be, that you may not be able to spend as much time or do things that you normally could just while you're in nursing school. And always stress this, that it's temporary. This isn't how it's always going to be. And I really recommend a couple weeks before you actually start the semester or a month or whatever, however long you need, that you start getting your kids and your husband and yourself in a routine, like bedtime routine, dinner routine, chores, and write out what everyone's supposed to do and how everyone knows the role, so it can help you not be as stressed. Another thing, develop that plan B. Say you have kids, and you know kids get sick, especially during the fall and early springtime. So you want to make sure that you have a plan B for if the kid can't go to school, who's going to watch them, how are you going to spend time with your husband, things like that, because nursing school has a really strict attendance policy. They take roll just like in high school or grade school. A lot of other degrees don't do that. You can just show up and do whatever you want. But in nursing school, they make sure that you're in class, and it can actually hurt your grade. So always make sure that you have backup plans. And before you start the program, this is where you need to start doing your routines, and you need to start making sure you have those backup plans. Number 4, develop a system of organization and time management. Now, if you're not the most organized person in the world, or you tend to procrastinate, now is the time to learn how to not to do those things. Because nursing school is going to require that you juggle a lot of things at once. And when you throw kids into the mix, a spouse, a job, things tend to get a little bit hectic. So now is when you need to prepare your plans and write out your schedules of how things are going to run weekly. And whenever I say this, I literally mean that you need to be planning out everything literally hour by hour. That's how I did it, and that's how I got through it. So for instance, get a planner. Any type of planner will work, whatever you like, digital, a hard copy. And Monday through Friday, write in everything, how everything is going to flow. From how dinner schedules are going to be, to helping your kids with homework, to doing your chores, paying bills, even nap times. Like literally have everything planned out. Because when you do that, you're going to use your time so much more efficiently than if you were just going on a whim throughout the week. And you want to make sure that you have everything together, because every single minute, every single moment is precious. Next, you'll want to combine, like be creative and try to combine your times wisely. For instance, like I noticed I didn't get to spend as much time as I wanted to with my husband during nursing school. However, I made it where he could start quizzing me and helping me in some of my classes, so that way he could quiz me, we could spend time together, we could laugh, and we could spend time other than me just going in a room and studying all by myself. So try to be creative with that and think of some ways you can do that. Number 3, do a mental tune-up. In the weeks leading up to starting nursing school, it is so important that you are psyching yourself out in a positive way. You want to approach the program with a positive attitude. Because let's face it, you've probably heard horror stories, how hard it is, how difficult it is, and things like that, and it makes you question yourself. I had this problem. So before you go into it, say to yourself, I got this, I want this really bad, I've always wanted to be a nurse, and I can do this. Because remember, like I've said before, if nursing school was that hard and that bad, we wouldn't have any nurses, because no one would ever get through it. So before you go, just remember, I am going to have some difficult times at times. I'm going to have some exams. I'm going to have some professors that are going to be a little bit tough, but I can get through this. I will do whatever it takes to get through this. I'll get a tutor. I'll study more. I'll get some study guides. I can do this. So just approach it with a positive attitude, work hard, and don't give up. Number 2, plan for regular leisure. Before you start the program, I highly recommend that you take some time out to either take a short vacation, spend some time with your children building memories, or your spouse, and do something that you love, where you're not thinking about nursing school, you're not thinking about stresses of life, none of that. Just take some time and enjoy it, because this is so important, because you want to go into nursing school feeling refreshed, because when you start the program, you're going to hit the ground running, and it's going to be intense, and you're going to need to be able to have leisure time. So do your leisure time at the beginning, but also while you're in the program, You need to take time during the weekends and during any breaks to enjoy leisure time, because nursing school is going to require a lot of time, and you need to be able to get away from that mentally so you don't get burned out, because a lot of times, a lot of reasons that students quit or they want to drop out is because they're really getting burnt out. So take that leisure time. And number 1, develop a support system. I had to put this above all the other points because I think this is so crucial in helping you get through nursing school. Just like with anything challenging in life, like losing a friend or something catastrophic happening in your life, in order to get through that, you usually have this one support system or this person to help be there for you, to help pull you out of it. And that's how it was for me during nursing school. I would have my days where something didn't happen that was good, or I was getting really frustrated, or I was exhausted and tired, and I was just seeing things a certain way, was questioning if I should even be a nurse. And I would always have my husband, who was a great support system to go to, who would, as I call it, pull me out of that ditch and show me, hey, it's going to be okay, you're going to get through that. So before you start the program, seek out who that support system can be and tell them, hey, I'm going through nursing school and I may need to vent and cry and talk to you sometimes. Can you be that person for me? Because that is really going to set the good foundation for you and help you get through it. Okay, thank you so much for watching. I hope those 8 ways to prepare for nursing school helped you out. And please check out my other videos about nursing school. And thank you so much for watching, and please subscribe to this YouTube channel.